Hey y'all, welcome back to another episode of the Committed to Me podcast. My name is Keisha Britton. I don't know why I paused for that.
I was like, that was a long pause.
I'm like, what name am I gonna go by? Okay, anywho, nice to see y'all back. How you doing?
Hey y'all, I'm Alexis Campbell, licensed clinical social worker and supervisor. Thank you so much for tuning in to another episode of today's podcast. Keisha girl, what do you got for us today?
So today we're going to be talking about navigating the health industry, staying up to date with your appointments, physicals, lab tests, all the good things.
Yes, okay. I love that.
Okay, taking care of your body is important. You only have one body.
Take care of it.
Got to. Okay, so first and foremost, there are a lot of stigmas associated with the healthcare industry, and that's why a lot of people tend to steer away from that.
What are some of the stigmas you
I think a lot of people are just iffy, number one, of having a provider that you feel like doesn't understand you.
Yeah.
Or not having a provider of color.
Yeah.
And feeling even more like they're going to like ostracize you in a way or just reject you totally. So I think it's important to do your research to find a doctor who you feel like has good reviews that you can relate to, even if it's a doctor of color. You know, all my doctors are minority women, and I get it. They are, all of them. But I do women. I can't do men. I just can't get into that.
I had a male doctor once, and it was not that bad of an experience, you know. And he was a coochie doctor too.
Really?
Yeah, old white man, coochie doctor, and he was very nice, very thorough. And of course, like there were other women in the room as well too, so that made me feel comfortable.
Yeah.
But it was like I felt like I got a lot of information. Now I have had like mixed reviews about being with a woman doctor that's a woman of color. I don't know. Sometimes it's a hit or miss. Some of my experiences have been really good with a male doctor, and I had some good experiences with doctors that weren't of color as well too. But I did some really extensive research, like you said. But what has been like one of your like, oh no, we got to keep going. This is not the doctor for me story.
Okay, story time. Gather around the fireplace, boys and girls. Okay, so this is about. My daughter's 3, so maybe like 4 or 5 years ago, I kept missing my periods. This was ongoing for like 3 months. So I did my research, found a black woman in Katy. Yeah, went to her, and she was just like, "Oh, maybe you're just stressed. Come back next month if your period's not here. We'll check it out again."
Okay.
Came back 2 months, same thing. Oh, we don't think it's anything. Just come back again and we'll do it then.
Yeah.
So I did my research and I'm like, okay, maybe it's fibroids. Like it's a little pain here and there. And so I had to like beg her for like at least 2-3 weeks to like give me this transvaginal ultrasound.
Wow.
And so she kept telling me that she didn't think I needed it. So she was like, come back your next cycle. If you miss it this time, then we'll give it to you. But this is 3 months. So I got the ultrasound. They found 2 fibroids, 2 cysts.
Wow.
So she came back in there, and I mean, literally, conversation was like 5 minutes. She was like, "So we did find 2 fibroids, 2 cysts. They're not big. You don't need surgery. Do you want to get on birth control?" Period.
That's always their go-to. Like, do you want to get on birth control?
Period. So I'm like, "Where's my pamphlet?
Yeah.
There's no printout. You don't give me no information. You're not telling me how they're growing. You didn't tell me to change my diet. None of these things, right?" So I'm just like, okay, so that's it. And she's like, yeah, you don't need surgery. I wouldn't touch it. You know, we don't need to do anything.
Okay.
So I left the appointment kind of like, I don't feel like I just had a good doctor's appointment, right? So I came home, did all my research, changed all the things on my diet, right?
Yeah.
Came back a year later, and I was like, I want another ultrasound to check on the status of these things, right?
Yeah. And this is the same doctor?
Same doctor. And again, I don't really think you need it, but if you want to do it, fine, we'll do it, right? Got it. They told me that both cysts went away, and then 1 fibroid has shrunk.
Okay.
So I'm like, okay, good.
Didn't even know it could grow or shrink. That's crazy.
Right? So, I mean, I went on a whole thing about estrogen dominance, read my books, changed my diet, all these things. So she comes in there, you know, and she's like reading me the report, you know, telling me those things. And then she's like, have you decided if you want to get on birth control?
What would that do though? Like, is there a reason? Is it connected?
So from what I have read is that if you have heavy periods, sometimes it can help with the period pain and cramps, right?
Okay.
However, doing my research, fibroids are estrogen dominant, which is the estrogen makes them grow.
Gotcha.
What is in your birth control is the main ingredient. Estrogen.
Child.
So I tell her, I say, well, from what I've read, estrogen makes them grow. So that would just make them grow or come back, right?
Yeah.
And she's like, well, you pick your poison. Word for word. You pick your poison. Do you want fibroids or do you want to get pregnant?
Are you serious?
Basically. And I was like, yeah, I'm gonna pass on the birth control because I don't want to get back on it. Right? Been on it since 18 up until maybe 28, 29. I'm like, I'm never getting back on birth control again. Right? And so I tell her that, and she was like, which one do you want to do?
Was she like a middle-aged white woman?
Girl, no, probably I say 35 to 44.
Pick your poison is crazy.
It's crazy.
Yeah.
And then it's like I don't think she knew that I did my research to know it's estrogen dominant. And so maybe that stumped her, but at the same time, birth control isn't a solution for everything. Yeah. So I've never went back to her. And to this day, like my primary care doctor is in like on the same floor but like a different office suite. And I'll ask her like, hey, I need a new gynecologist. Anybody you recommend? And they recommend her like 4.5 stars on all things, good reviews. And I'm just like, when I tell you like disconnected, no conversation, like maybe she had something in her personal life, I don't know. Yeah. But I'm like, still, there was
like a lack of education there.
It was. Yeah. It was. And I'm like, thankfully I'm in healthcare enough to know, let me do my research, right? But what if I was somebody who didn't know what to look up, where to start? Yeah. Right? And then I could be doing all the things to make them grow, get even worse, right? So it's just like, I feel for those patients that don't have the verbiage or education to support themselves. So I never went back to her. And then funny thing, with what I'm going through now, I was talking to my like supervisor at work about it, and I was telling her the same story. So she was like, what's the doctor's name? So I told her. She was like, get out of here. That's the one who delivered my baby because her original doctor went into labor the same time she did. So the gynecologist I'm referring to was the backup doctor. And she said that she ran into her like their first appointment and she didn't like it. So she switched to her gynecologist just for the same lady to deliver her baby. And she was like, I will never go back to her ever.
Yeah, no, because it's only a matter of time before she does it to another person.
Thank you.
You know?
Thank you.
That is so interesting.
It is. And she was, I'm a diehard advocate for Black women providers. And she was one of those. So it just goes to show, like you said, not everybody is, kinfolk kind of thing, right? And even if you do your research, she had good reviews, but I was like, that experience I don't like, and I'm not gonna give her any more chances after that. So
I only had like one really good, thorough Black doctor who was also OBGYN, and she was so thorough. And you know how many years ago? That was like 10 years ago. Like, she was so thorough, and like she asked questions. And the thing about it is, at the time, of course, like I wasn't seeing her because I was like, a teenager and things of that nature. But my mom was seeing her. So, and like she had a full like rapport and history with my mom. Been with my mom through different like procedures and births and things of that nature. So then when I started seeing her, once I got a little bit more into like high school and then like into college and stuff, like she was just always a really good, thorough provider. But then my insurance changed.
Man,
and it's the worst because like when your insurance changed, you have to almost like start all over again and finding a new provider. And with America's like healthcare system right now, it's so trash. Like, some people are like trying to find a new provider every year because the insurance market is just so unforgiving. And so ever since like I left her, and I would say that was like back in like 2015, I've been trying to find like another provider that like has that same energy in terms of education, informing me about different things I could do, that's also just showing like a sense of caring and compassion. I remember I went to one doctor's office and I really did like the doctor, but her staff, the medical staff around there, was just not up to par. And I feel like that's also a reflection of like the space you create for your patients. I remember I went in because I was concerned. I had a concern regarding like breast cancer, because that runs in my family, and like, or lumpy breasts runs in my family. And so where we may have like a benign cyst or something like that. And so we've always been told, my mom has always told us like, hey, if you feel something, go to the doctor, because you just never know. And of course, like, I don't have a relationship with my biological father, so I don't know what that side looks like or whatever. So I'm nervous. I'm concerned. I'm like, oh my gosh, I got this lump. I need to go to my doctor. Went to my doctor. They literally had me waiting for hours to be seen. And you know me, I am once you got past that 15-minute threshold, I'm pacing at this point because I'm like, what's going on? It's like, do y'all have my appointment? What, do y'all not have my appointment? Like, what, like,
right.
I'm anxiously waiting, and I wasn't prepared to like sit for that long. And I also was like trying to balance that in my work schedule as well too. And so it was just not the best experience. And then they waited forever to call me back about my results. So I was just like, okay, I have to find a new provider. Like, this is not okay. And I remember like I did like a follow-up appointment, like I think like months later, because she then referred me to a dermatologist to go see about like the lump and everything like that. And the dermatologist, I will not forget this experience. And I even took it to wanting to report it. I think I had told you about. I was like, I think I'm gonna report this man because he done pissed me off. I literally went to the office, but as soon as I sat down, he did not check, look, anything. He went based off of like the information I gave to his receptionist on the phone when I scheduled the appointment. He was like, I already know what you got. I already know what you're dealing with. Like, I already know. I said, do you want to look at it? Like, do you want to like see it? Like, I don't know. Like, is there going to be any tests ran? Like, what's going to... So he gave me information about what he think that it is, but I'm already on the fence because I'm just like...
You didn't even do an exam.
You didn't even do an exam, so how would you even know? And literally, I left the appointment. I was so, like, disappointed. I felt so defeated because I was just like, bro, like, it's hard enough trying to get an appointment. You know, it's hard enough trying to get an appointment within the same month with some doctors.
I say, especially if you're a new patient.
They
push them new patient appointments out
3-4 months out. And I literally, because now with some hospital systems, you can go and see what the doctor put in their chart. This man I had a long conversation with Alexis. Literally, it was 15 minutes.
I was going to say, they slot is only 15 minutes anyways.
What's so long about that? I had questions, you know, and then he was just like, I guess, then he said I provided patient information based off of my assessment, and the patient seemed disgruntled, and she left out of the office. That's not what happened. I was like, that's not what happened. And I was just like, wow, like, you're painting me as like a difficult patient when I came in concerned. I came in with questions. Am I not supposed to ask questions in my appointment? Like, it really rubbed me the wrong way. And I reported him, and I reported that like the appointment wasn't long. It was just 15 minutes. I said I had questions and I wasn't disgruntled. Like, you're telling me. And then the thing is, like, y'all, he was discrediting other providers that I've seen in the past who told me like, hey, you need to go get this looked at. It's probably really something concerning. And he was like, but you know, they don't necessarily know what they're talking about. Like, they're just this type of doctor. They're just that type of like physician. They really don't know. And I'm just like, all right, like, you know, like, this is just not helpful at all. So I reported his ass, and I would encourage anybody to report their doctors that gives them a negative experience, because at the end of the day, you shouldn't be in that position if you don't have compassion and if you're not trying to create space for your patient to ask questions. Like, you just
Agree. And I think that's the challenging part about navigating healthcare is, what if you do get rejected, right? What if your doctor does brush you off, or they rush you, or they don't give you the chance to ask questions, right? And then you could easily be discouraged. Yeah. You know, but you got to know, like, what are my options, right? I can always file a grievance. You know, I can always call patient relations. Yeah. I can always look for another provider. I don't have to, you know, take that type of treatment from somebody.
Did you ever have any, like, positive experience going into, like urgent cares, clinics, the emergency rooms, like, especially being in the hospital system and working for like that as a healthcare provider?
Luckily, I've never had to go to the emergency room outside of being in labor.
Yeah.
But that was also not a good experience with the nurse. Like, you know, check-in process was good. But you know, okay, well, I was gonna say, you know, when you're in labor, but you know, so when you're in labor, like, your bowels are gonna be emptied out. Like, you're cramping so much, you're on the toilet letting everything out that you have had in your system. So I constantly had to get up in the middle of contractions to go to the bathroom. Yeah. And the nurse was getting upset because she was like, I don't want her to have this baby on the toilet. I need her to lay in the bed. And my husband is like, but she has to go to the bathroom. And I'm not talking about number 1 and 2. I mean, like, everything is coming out. Whoa. So you got to go. And I'm like, I'm not about to, like, use the bathroom on myself when I'm competent enough to know I got to go to the bathroom. So
they ain't give you no bedpan?
I don't know. That bedpan would have filled it. Oh my God. I mean, everything coming out, right? So I was like, I gotta go to the bathroom, right? Yeah. And so it was just like, if you're working in the OB/ED, right, you should already know the pain level that women are going through, and you should already know, okay, your bowels are gonna be empty when you're in labor. So I feel like that was a disconnection with the nurse, because you know how it is. I'm not your first, fifth, or 15th patient, right? You know what it's like. So even if you feel like I may have this baby, come and check me, do an exam, right? If I gotta go to the bathroom, I go to the bathroom, right? Yeah. And even the doctor who I guess came to see me in the ED, he was asking a whole lot of questions in the middle of a contraction. Yeah. And I get, like, you got to do your assessment, but not in the middle of a contraction, right? I can't even keep my eyes open, and I'm trying not to scream to hold my pain in, and you want to say, how many miscarriages have you had? How many abortions have you had before? Like, let the contraction pass. Yeah. Then ask me the question, or review my chart and say, okay, I see you said you had X amount of miscarriages. Is it accurate? I can tell you yes or no, instead of you trying to make me form a full sentence right now. Literally. So I've never had to go to the emergency room outside of that. If I've gone to the urgent care, it's only been for like a sore throat, a cough, something like that. And I go to like our urgent care centers like down my house. Yeah. And that's a quick in and out. I ain't had no issues. But those doctors have been thorough. Like, I haven't felt like good. I wasn't being listened to. And they prescribe my medicine. A lot of times I really do the tele visits where you can call in. I haven't done those yet. I like those. Literally, I send my picture of my little rash or something. Somebody call me and you send my prescription in 5 minutes. Oh, that's nice. Done. So stuff like that, I prefer that, because I ain't got time to come all the way make a doctor's appointment. I want to come in. I am old school. I like to come in. I want you to see it. I want you to see what's going on. Like, get a thorough history face to face. Like, telemedicine, I think it has came a very long way. But to me, you just cannot get past like making that doctor interaction. And after a couple minutes, not a couple minutes, but after a couple years, if I've been with you for a while, I'm okay with seeing you virtually. But like, you wasn't scared about the whole labor, because they said Harris County in Houston, Texas, is like number one. Did you see that? Number one for maternal death. Like, that was crazy to me. I'm like, oh, I'm not having a baby here. Like, I can't have a baby in Houston. It was a fear period. Just knowing I'm a woman and I could die in labor, that's always been a fear of mine. So I just really make sure to tell my husband, like, hey, if something happens, choose me, because we can always make another baby, right? And I mean, even if it was flipped, I wouldn't want to raise a child by myself, right? That's hard. So I was like, choose me, number one. Number two, I literally told him, do not let me die on this birthing table. Like, be attentive, pay attention if anything is happening, speak up for me, you know. So I gave him like a little pep talk. But I mean, thankfully, like, everything worked out right. And they were very attentive, so I had a good experience, but I was terrified to give birth, right? I for some reason I associate childbirth with death. I mean, it's not that far off. They said woman's very close to that. Yeah. And I've seen stories, like so many stories of women going into labor, and like, I think it was somebody recent, a couple months ago, I don't know what state, but she was a black woman, and she literally got sent out, like, they discharged her in the middle of labor. What? I think something related to insurance. I don't know. But just stories like that. Yeah. Are very nerve-wracking. Yeah, it is. I agree. I think it's just knowing your rights, speaking up for yourself. Like, even if you got to bump heads with the doctor, like, what's your concerns? And don't feel like just because they're the profession that you can't really say what you want to say, or say, hey, something doesn't feel right? I feel tired, I feel weak, or whatever. Like, pay attention to your body enough to know when something's wrong. So how would you tell them and how to, like, rate your pain? Like, what would you say? Because they use that scale, like 1 to 10. Girl, everything's a 10 sometimes. No, really. Okay, I just saw this video. Somebody sent it to me. It was a doctor talking about, like, this is how you should voice your pain, right? Yeah. Because a lot of us will say, oh, okay, the pain comes and goes, right? Yeah. Or it's manageable if I take medicine, like that. And he was like, when you say stuff like that, the doctors don't think it's an alarming pain, and they're going to think that you're okay. So he was like, you have to tell them, like, hey, my pain is a consistent 8, right? Yeah. No matter what I do, it doesn't go away. Right. I've tried this medicine, it continues to stay. And you can even say it's hindering me from doing X, Y, Z.
Yeah,
right.
I want to see them activities
So
daily.
exactly. So you just have to put it like that, and don't try to voice it like, okay, I can handle it. It's a little hard, but I can handle it. You know, like let them know I'm struggling. This hurts. I need some help.
Yeah,
right?
It's not manageable.
Exactly, because we hear a lot of stories how they will, try to minimize the pain of Black women, especially, right? And so you just gotta know the verbiage to play along. I feel,
yeah, I feel like even when I feel like even in a health, where is wrong my words? Even in a mental health setting, you also have to be very verbal about like what you're experiencing. I tell people go as deep as you can in terms of describing the pain. Like this pain feels like a watermelon on my chest, or this pain feels like there's like a rock in my throat. Like um, giving a descriptive way to describe your pain can also help to kind of measure the size and the heaviness of something. So just saying like, oh yeah, like it hurts, but I can still do X, Y, and Z, that's not helpful. So I agree. Like get as descriptive as verbal as you can about like what this pain is like for you, because again, like yes, they're the professional, but like you know your body, and you know when something's not right. Even if you can't push past it, don't.
Right. And I think that's the problem, that we always want to push our bodies to see what we can handle. And, a lot of women will say, oh, I got a high pain tolerance, right? That's not going to help you, because they'll be like, well, your tolerance is high. You're fine. You can manage it, right? But you don't have to be in pain. There's things to solve that, right?
Yeah.
So I think it's important to voice how you feel. Always speak up for yourself. Even like doing like my 9 to 5, like I'll tell patients all the time, do you want the line to put in a complaint? And I let them know like it's not to get anybody in trouble, but the system's not going to know how to fix it if you don't speak up, right?
Yes.
And a lot of people are hesitant to speak up against providers because they feel like, well, I don't want to get them in trouble. Well, also, if you're a provider, there's a certain standard level of care
you should be able to be providing.
Exactly. Are supposed to give to your patients. There's a certain way that you speak to them. There's a certain way you handle cases, right?
Yep.
And if you're not doing your due diligence, you're not handing out the care to the people that they need. You got to go.
You got to go. So, and the thing is, it's like it's not on you to save that person's job. What's on you is just to make sure that you're getting the care that you need. And so I encourage people take it there, because at the end of the day, if that doctor's burnt out, then there's a system. There's a flaw within the system, and at the end of the day, like we can't change it if we don't talk about it. And so it's okay to put things out for what it is and call it for what it is, because at the end of the day, like that's your health.
I agree. And even like you said, it's a system, right? So even if the doctor's burnt out, okay, they need to tackle patient caseload.
Yeah.
And then, but nobody's gonna know if nobody speaks up to say there's a care gap here going on.
Yeah.
So that's important.
And then also knowing how to navigate the ER. Like y'all, I know that like people think that you're supposed to go to the hospital and they're supposed to fix it all. No, that's actually like your first stop. Like, and you got to go to other physicians, other specialty cares, because they're actually going to pick up where the hospital left off. Like the hospital is just trying to make sure, like, okay, you
not dying,
right, not dying. Right. But like some people, like I think that's a huge misconception about hospitals. It's just like, oh, I went to the hospital, they didn't fix the issue, nobody's gonna fix the issue. No, you went to the hospital, they told you, they may tell you, they may not tell you, but at the end of the day, like you got to go to a specialist, you got to go to the next step, and only you can do that. They're only going to take you so far in the hospital because they're trying to prepare their bed for the next person. And so I think people miss that, especially in the Black community. They miss that, like, oh well, I haven't, my PCP is my my emergency doctor. It's like, no, that ain't your PCP. You gotta have like a primary care physician that, or a specialist that's like knowing your history, because ER doctors, they know a lot of information, but they don't know your history. So keep that in mind.
Yeah, so we just wanted to let you guys know to take care of your bodies, take care of your health. You got to stay on top, manage it. Do your annual physicals, request all the labs that you want to request.
Yes.
Do your research online so that when you go to the doctor, you got questions, right? And the doctor is only going to give you so much information. So you need to like take your health into your own hands, to have your questions prepared, to be knowledgeable, so that when you have that visit, if you feel like the doctor didn't do XYZ, you already know what to look out for because you've done the research, right?
Yeah.
Don't just go in and expect your doctor to lay everything out for you. So I think it's important to like do your work before you have that appointment.
So we will see y'all next time. We hope y'all enjoyed today's episode. And let us know in the comments, like, you know, some of the good experiences that you've had with doctors and some of the not so good experiences you had with doctors and ways that you've healed through that. And so we would love to hear from y'all. You can always send a email to us in the For Therapy mail. What is that email address again?
CommittedToMePodcast@gmail.com.
Yes, that. And so we will see y'all next time.
All right, bye.
Bye.